Good morning, and thank you for joining us for another Compass Affordable Housing Compass Ecosystem podcast. My name is Carolyn Gorst, and I am the Director of Development here at Compass Affordable Housing. And I am again thrilled to be bringing this podcast to you with my co host and partner in crime, Lydia Aranda. Hi, Lydia.
Hi, Carolyn. Nice to see you again. I'm so excited for today's episode.
You and me both. It's really been an exciting couple of weeks, or actually couple of months now, as we've been building our ecosystem podcast and exploring our Southern Arizona ecosystem. I want to remind our listeners before we get started that the purpose of the Compass Ecosystem podcast is to inform, engage, and to connect with the Southern Arizona community in a dialogue about our human development ecosystem. And today, our guest, I think, really shows, really talks about a big part of the work that is done in creating a healthy human development ecosystem. We're joined today by Dr. Francisco Moreno from the University of Arizona Health Sciences. Along with many other hats, Dr. Moreno is here today to talk more about the health and wellness and human behavior part of our ecosystem. Hi, Dr. Moreno.
Hello, hi Carolyn and Lydia. Thank you very much for inviting me to be part of the ecosystem.
Well, we are really excited to share the work that you are doing, especially at our University of Arizona. As an alum, I am so always proud to shine a light on the work that's being done there. To kick things off today, we'd like just to start off, let our audience know some of the work that you are doing and that the University of Arizona Health Sciences is doing, and the target audiences you work with, some of the services you provide, some of the outcomes that you're seeing.
Great. That might be a little bit much for me to remember to cover in the next part of our conversation, but just guide me back to talk a little bit more about that. So again, as you mentioned, I'm a psychiatrist, so I work in behavioral health, and I have been dedicated to expanding services to individuals that may have less representation in services for health sciences beyond just behavioral health. Part of my work is as a associate vice president for student engagement and career advancement is to support the development, the educational development and the clinic development of people that are going to help us take care of the needs of behavioral health and general health here in Southern Arizona and beyond. It's definitely a great opportunity for us to serve, especially those that have been that have most opportunity, the individuals that are in communities that are not adequately served physically and behaviorally, and trying to make sure that we invite individuals from those communities to be members of the education, service, and research connection that will match the needs of that community also.
I love that. It's so much easier when we are being receiving treatment, especially in our behavioral health, even physical health, from people who we feel are like us. And there is such a gap in services, one, for behavioral health being available to individuals who might be on lower incomes or in traditionally underserved communities, and being able to have someone who has a similar life experience has to mean, it has to make such a difference in treatment, I would think.
Absolutely. The ability to connect with your provider, and I'll speak about my own experience. As a Spanish-speaking provider for a very long time, I was one of very few behavioral health providers that could speak Spanish in a community that has become minority majority for a long period of time, with a very high proportion of immigrants from Spanish-speaking countries and many other countries that, for whom English is not their first language or have English proficiency challenges. And then in addition to that, it's not only about the language, but also understanding where people are coming from. And in behavioral health, that is huge, being able to relate to folks and connect with people in a number of ways. Then many aspects of our culture is not just where we're coming from or what ethnic background we have, but what road have we traveled? What life experiences do we have? What pain do we carry? And also, what have we done to contribute? So a lot of this become really essential in terms of who do we want to be preparing to help us serve our community.
I think that it's so important. And you really have set us up for the next part of our conversation after we get back from our break. Lydia, I know you are just ready with a couple more questions to build on this. We're
I
going to
sure am.
we're going to take a quick break here and hear from our sponsor, Tucson Electric Power. Thank you for Tucson Electric Power. They are our major sponsor for this segment and for today's show.
It's important that Tucson Electric Power partner with agencies like Compass Affordable Housing to ensure the members of our community have access to the resources that they need. We understand that we're operating in an affordability crisis, and this is not something that can be solved alone. Together, we can achieve so much more.
And we're back. And for this segment, we would like to thank our segment sponsor, the Pima County Short-Term Crisis Emergency Resources Grant. Dr. Moreno, thank you so much for that highlighted overview of all the different ways that you and your work in the University of Arizona Health Sciences really pay attention to the students coming up and into the system, as well as the service that is being provided back out. What I hear a little bit is student engagement, career advancement, as well as the studies and the research that's going on. I wonder if you might share how in that work that you do, that you lead, and that you convene, how certain specific issues in community, or as you started to say already, groups from the community are served.
Yeah, thank you again, Lydia. So we're in Southern Arizona, and when we were working to identify strategically what groups we wanted to be working with, so what do we have a lot of? What communities do we have that are overrepresented in the areas of need? And of course, we had a very large Latino community, a very large Native American community. We had people with limited English proficiency. We had a large border community and a lot of rural areas that required attention. Arizona, in many ways, is a rich, but also a state that has a lot of financial difficulties, a lot of poverty in our communities. And many of our folks have not achieved as much in education as they should have. And so we have prioritized working with people that are coming from financially disadvantaged backgrounds and educationally disadvantaged backgrounds. And of course, trying to prepare individuals so that we can all be better able to serve the needs of those communities that we mentioned may be overrepresented in our state, but have a severe underrepresentation of health professionals along the continuum of health professional effort, anywhere from what we have called historically allied health professionals to the people that are providing specialty care in different areas. So those are some of the areas that we work with, and of course, this is work that is part of an ecosystem. Sure. It's not something that one individual or one organization will do together. So we have been the most able to be successful when we really engage with our with our education and service partners all over the state. And when we also leverage resources that are coming from funding agencies such as the state of Arizona, um, federal government, Department of Health and Human Services, grants from NIH, the National Institutes of Health, that allow us to really kind of bring in, to start training people so that they could be more competitive to advance their education at each step of the way. And one thing that we had mentioned to Carolyn briefly a moment ago was it's not that you have a strict pipeline of people that are just moving, from here, and I know I want to end up here, but rather many of individuals from the communities that we're working with are going to be landing on the next phase of their development, work at that area, grow, and move on to the next phase. As long as, again, we continue to be fulfilling our interest, fulfilling that curiosity, and being able to serve people to the best that we can, and then moving along the line of that educational and service progression. That's what we're looking forward to.
I really like that service progression and looking at all of those facets for outcomes that really serve everybody, not just the communities or the patient base, I might say, but also the professionals themselves, the students in in their residency or in their other trainings themselves. Much like I know your background in story, where as you go along, I think this applies anywhere, as you go along and you have experiences, you need to check in because maybe you might find something else in addition that you want to do that you didn't know of before as you're in that journey. So we have both sides that are exploring and learning.
Absolutely.
And that you and your colleagues are being a hub for that and working with other organizations too. I wonder if you might tell us a little bit about those collaborative partners, those other institutions. In other words, they are not only in the higher education system, they might be nonprofits or private sector as well.
Yes, absolutely. We work with community service agencies all over the state. We work with educational institutions, K through 12 systems. As an example, this week, today, we welcomed a large number of students to our summer programs here at the university. And that involves many high school students, rising seniors in high school.
Mm-hmm.
We were able to recruit them through our partnership with different school districts around the state.
Nice.
We're able to host them here. And when they come, they get exposure to the health professions, right? So we have people with all kinds of services coming over and talking about this is what a day in my life looks like. But we also partner with educational institutions that they don't only come and tell our students about their program, but they're inviting us to physically come and tour us in their facilities. Some of them host us overnight in their area, and they show us the residential dorms and things of that nature. So our students get a chance to visit a variety of different healthcare and health promotion services around Southern Arizona and visit universities and other colleges in Southern Arizona and Central Arizona as well. And so those are some examples of how we're able to really give people broader exposure. And it's not just a come to the U of A kind of pitch. It's more like come to health sciences, and there's many pathways to arrive to the destination you're still working on finalizing.
Oh, that's so wonderful. Carolyn, don't you agree?
I agree. And, I just want to go a little deeper with this because something you said is just, I think, really important for our audience to understand. We are talking about helping youth plan ahead for careers in behavioral health. And right now, I think all of us know what the times we are living in.
Mm-hmm.
Behavioral health, mental wellness has really come to the forefront in what a big part. It's not just about our physical well-being, but it is our mental well-being. That makes up the whole person. And I'd love for you to go a little deeper about how do you get these young people to participate in such important exploratory work at this point in their lives? Because that has to be just life-changing for them, but also for the communities they're coming from.
Yes, absolutely. Is one point of clarification. We have multiple individuals coming over to do this career exposures, but we don't have a focus on behavioral health for everybody. But
Okay.
there are some people who have an interest in behavioral health, and we assign mentors, rotation, and research experiences in behavioral health so that we can really nurture that interest along the lines and really help them advance that going forward. Having said that, everybody that comes to our program, we have a curriculum of what we believe is part of our everybody's personal development to learn about mental health. So everybody goes through our mental health first aid curriculum. We have certified facilitators so that people get more familiar with it. That everybody learns about suicide prevention, substance use. Um, Wellness, a variety of different challenges that may be encountered. And we also have a behavioral health counselor that works with our office and has availability of time for all students. We, of course, provide also different presentations about the career of various people that work in behavioral health to kind of give a better exposure to them of the path for those careers.
Gosh, that's great. Not only in the field of study, but also the application for the student's own well-being, and as they continue on their path to continue being well themselves, so they can give their most.
We have used this sort of whole community, whole health model, similar to what the CDC uses for schools or have provided for schools. And so we want to make sure that our students are themselves healthy, safe, engaged, supported, challenged, and that we provide experiences for sort of cultural support in addition to making sure that they're not hungry, that things like that.
Wonderful tools that you're sending them back home with,
Mm-hmm.
because those are implementable immediately, even if you aren't pursuing. What I'm hearing you say is, you know, the being able to talk to a friend who might be in crisis, the mental first aid, something we require of all of our team members. The being able to have trauma-informed conversations in a manner that lets people know they have a safe place. And again, I go back to within this people that are also from their community. So it's not some third party telling you how you should be behaving or how you should be thinking.
Mm-hmm.
Um, should is not always a great word. We're going to take a quick break here to hear from our third segment sponsor, Tucson Osteopathic Medical Foundation.
Annually, we give to local organizations who are running programs and making great strides in what we call the social determinants of health. It's incredible the work that they're doing, and we're just really proud to be a part of it.
And we're now back for our third segment, but first we'd like to give another mention of thanks to our podcast and program major sponsor, Tucson Electric Power. Dr. Moreno, there was so much that we covered in such a little bit amount of time, lots of questions, and I am sure, especially at that last few comments on looking at the whole person and the whole community and being able to serve holistically, how might Southern Arizona residents or Southern Arizona community organizations or others who find that they want to get involved in this endeavor that you and the University of Arizona Health Sciences and so many others are in, or if they are students that might not have quite found their way to you, how might they get involved? How might they find out more?
Yeah, thank you, Lydia. I think the Office of Student Engagement and Career Advancement at the University of Arizona Health Sciences uh, will continue to have a presence. We invite individuals that are interested in partnering with us to invite us so that we can have conversations about ways in which we can support each other. And similarly, those that have students that are interested in participating in our activities, we are, of course, interested in supporting students anywhere from juniors in high school, those that are going to allied health professional schools, those that are going through pre-health trainings, those that are preparing for admissions to health careers, and those that are already on their way out of those to establish professional practices or research practices. We're here to support everybody. We have a great team of mentors and peer mentors that provide amazing support for each other. And this is how we keep learning where the pulse of our community is when we hear the needs of individuals, what they're interested in, what we may be able to do. And that's how we keep evolving and remaining impactful.
So important. I really heard you say that not only are you welcoming to the input, the outreach, the questions that may come your way. And when I say you, I mean you and all of your colleagues in the whole division, but also that you are paying attention to what you hear, see, what the trend, maybe trends and behavior trends and curiosities may be, levels of interest, so that you can evolve as times deem. Quick point, if I may, if we have enough time, I'm just going to say many decades ago, as a new college student, I began my college career at the University of Arizona, and I was a pre-med student. I did not end up pursuing that path, but I also have to say that although there was a lot of help, there weren't quite these kind of really proactive, engaging, welcoming type of sessions that I see going on now. And I think it might have even changed my mind back then. But I am thrilled to know that this is happening and that all of us can play a role together in the wellness of our community at large.
I agree with you, Lydia, and I'm going to throw one last question to Dr. Moreno because I really love the idea that we are bringing youth into a field that they may not feel is accessible to them if they don't get the exposure. And with the medical field as a whole needing talent, what is one message you would want to get out to our young people that are living in communities that traditionally wouldn't think of medicine or pursuing a career in medicine at a upper level, like becoming a doctor or a therapist, uh, a master's level counselor? What is one piece of advice you would give to the young people that we can talk to today?
That's a great question. I would say the worst thing we could do is to cut ourselves short, to settle on that's out of my reach, that is not for me. Talk to somebody, you trust. Our office is here to also, of course, provide input and guidance to individuals. We have a bias. We believe everybody could make it. We know that there's a lot of very talented individuals. There's a lot of very smart people that have great capacity to do well academically. Those individuals, independently of the financial condition, the challenges going on socially in the family and otherwise, they have a very good likelihood of being successful along the path of getting pretty high up in the medical healthcare academics. Even if you're not doing very well, because there's a lot that is going on. There's different pathways, different ways of getting to the same destination. And in our communities, that's often something that is found by individuals, starting working as nursing assistants sometimes, moving on to a associate in nursing and then advanced nursing degrees and working to nurse practitioners, doctors in nursing, individuals with specialty in a variety of areas that are doing just cutting edge service and make a good living along the way. So we all have an opportunity. We all have a pathway. Not everybody was born with a scholarship to the university. It is a challenge, but there are communities like ours in which we can tell you about how to apply to college, how to prepare for college, how to fund college, how to find assistant for that. And it's really important to make sure that you're not alone, that there are places where you can learn a lot more about that.
And I love that you are also saying there's just not one pathway to success. There is a pathway. You just have to find the partners to walk with you. So, oh, Lydia, this has been such a great segment. I am just so thrilled, Dr. Moreno, to have you today. Is there a
Very inspiring.
Very much. Is there a website or that anyone listening today would be able to reach out to contact to learn more about, such as the summer program that you have running right now?
Give me 1 second.
It's okay.
As you look for that, I'm going to just, in case our viewers aren't able to quite read the logo that you have, I also wanted to bring attention to the fact that research plays a lot into these pathways, and it is one of those gateways into the field of the many fields of health sciences. And your logo there at the bottom of the screen says Southwest Center for Advancing Clinical and Translational Innovation. And it's all about research and overcoming barriers to research, maybe funding or other kinds of collaborative initiatives that really help to inform. So if people are curious about that, they might want to ask you, you and your team, a little bit more about the Southwest cacti.
Absolutely. Be happy to say a lot more about that now and also later. And just in a nutshell, Southwest Cacti is the result of a collaboration between the University of New Mexico Health Sciences, University of Arizona Health Sciences, and Banner Health, where we're putting our teams together to really facilitate research done across both states with national reach. And this is a way of facilitating training for researchers, community engagement, and research implementation, so that whatever people learn in research can be brought back to the patients and the communities where we live at. And we're very happy to be part of that program.
An ecosystem in and of itself.
That
An
is
ecosystem
true.
for sure. So the best way to contact us here at the University of Arizona Health Sciences Office of Student Engagement and Career Advancement may be through our website at uahs-oseca, OSECA at arizona.edu. Phone number is 1-800-841-5948. And again, just look under University of Arizona Health Sciences Student Engagement. You'll find us without much trouble.
Fabulous.
Fantastic. So anyone listening today, if you want to learn more about our guest or what the work that is going on, we invite you to always come to our website at Compass Affordable Housing, www.compassaffordablehousing.org. My great thanks go out to Dr. Moreno and my wonderful co-host Lydia for such an engaging conversation today on building an ecosystem in the medical education pathways. And I appreciate the work that you both are doing. Thank you so much, Dr. Moreno. Thank you to all of our watchers. We'll see you soon.
Thank you.
Thank you.